According to the American Heart Association, every year about 40,000 children in the United States are born with a heart defect. As the leading cause of birth defect-related deaths in the U.S., congenital heart disorders can be so slight that the signs and symptoms can sometimes be difficult to recognize. Oftentimes, parents are unaware that their child or unborn child has a problem.
I came to learn that my child had a heart problem during a routine OB sonogram at 28 weeks. My doctor realized that there was something wrong with my baby's heart.
We went in to find out the gender of the baby, and at that point the tech noticed something wasn't quite right.
The prognosis for children with complex heart disorders used to be very poor, with more than 50% of children losing their battle to stay alive.
There's lots of organs that you can somewhat do without, but your heart is not one of them. And, you know, it was just a scary thing that, you know, is she ever gonna come home? Is she ever gonna leave the hospital? And, you know, what kind of care is she gonna need after?
I began to cry. I was in shock. I felt so many emotions at the same time. Sadness, fear, guilt. I began to ask myself too many questions, such as, what did I do wrong during my pregnancy that may cause this problem to my baby?
Today, thanks to advances in heart surgery techniques, survival rates for children with heart defects have dramatically increased.
Well, the purpose of the fetal intervention program is basically to take pictures of the heart of the fetus. In other words, the baby before birth. If we can pick up a disorder, then we can anticipate the care we're going to have to give that child ahead of time. We have our cumulative experience over several generations of surgeons who have shared their knowledge with exactly how a repair should be done. That has now allowed us to be more precise, more predictive with the diagnostics, more precise with the therapeutics, and better with the follow-up too.
When surgery is required to repair a heart problem, specialists are now utilizing a host of new technologies in the operating room. Breakthrough medical advances are allowing doctors to use special, high-power optical lenses to perform surgery on hearts that are oftentimes no bigger than a walnut.
Another system that we have is called iRounds, which is a web-based medical record system. For any of us anywhere in the world that want to know about a patient, it's immediate information, it's totally accessible, and it gives us very accurate, up-to-date data on the status of every one of our patients.
Learning more about the medical advances in heart surgery and having a better understanding of the process can help families cope better during this stressful time.
I can tell parents that their child has greater than 90% chance of making it through the heart surgery. And that's a lot different than it was in the past. It's an optimistic viewpoint, it's very realistic. I can also tell them that I can expect their child to grow up relatively normally, to become a young adult, to have a job, to get married, to have children, and hopefully to lead a normal lifespan.
First of all, it's never easy to face the fact that your child is going to be born with a defect, in this case a heart defect. But I will encourage the parents to not fear the unknown. They should empower themselves with knowledge about their baby's condition.
Just do a little bit of history on the internet, research, just finding out about the condition, just so you know what your expectations are. Get a tour of wherever it is that they're going to be and find out how much access and contact you're going to be able to have. I think that was a huge comfort level for us, was that, you know, we got to know the nurses. They were okay with us calling at all times of the day and night to check on her if we weren't able to be at the hospital, which, I mean, we were most of the time, but I mean, I think it's important to be able to entrust your child to whoever they're being cared by.
Well, hello there. Hi, Sebastian. How are you?
Hi.
How are you? Aw.
Hi.
Known as a sanctuary for hope and healing, Arnold Palmer Hospital for Children in Orlando, Florida, has become one of the most trusted names for children's health care worldwide.
I think the hospital is viewed as the place for sick children. At this hospital, we know kids well. We've been taking care of them for almost 100 years now. It's all about understanding the needs of a child and also understanding the needs of parents and siblings, and that's what we call the family-centered concept of care here. So we believe we know children well and we know how to take care of them.
Committed to delivering top-quality care, Arnold Palmer Hospital has joined forces with Miami Children's Hospital to create the Congenital Heart Institute, a state-of-the-art cardiac care program.
This field is not just about surgery or just about cardiology. It's about developing in parallel surgery, cardiology, anesthesiology, and nursing expertise. And that's what this institution has done to create this center.
The Congenital Heart Institute is utilizing the latest innovations in pediatric cardiovascular surgery and interventional cardiac treatment, assuring that children receive superior care.
The staff from Arnold Palmer and the Congenital Heart Institute, they are excellent. My whole family, we are so grateful for saving my baby's life.
Sophisticated technology and procedures mean quicker recovery times, shorter hospital stays, fewer hospital visits, and ultimately, better health. For more information on Arnold Palmer Hospital for Children or the Congenital Heart Institute, log on to arnoldpalmerhospital.org or call 1-407-649-9111.